Case 7. A 6-year-old boy is followed by his pediatrician for delayed language acquisition and behavioral problems at school. He has always had a long face, large ears, and flat feet. His mother reports a normal pregnancy with adequate prenatal care and adds that she did not use drugs or alcohol during the pregnancy. Genetic analysis reveals a normal 46XY karyotype, but an abnormal appearing X chromosome. What is the most likely diagnosis? This boy has Fragile X syndrome. This disease occurs in individuals who have an expansion of a CGG trinucleotide repeat sequence on the X chromosome. The expansion results in hypermethylation of DNA in the 5' region of the FMR1 gene, which silences the gene by inhibiting its transcription. The FMR1 protein is an RNA binding protein. What is the inheritance pattern of this condition? Fragile X syndrome is an X-linked genetic disorder. It is the most common inherited cause of mental retardation. The hallmark of X-linked disorders is the absence of father-to-son disease transmission. These disorders are much more common in males than in females. However, mild symptoms of Fragile X syndrome appear in a significant minority of female carriers. Fragile X syndrome is not fully penetrant, and many families show a maternal transmission pattern. What physical abnormalities are associated with this condition? Individuals with Fragile X syndrome frequently have long, narrow faces with a large jaw, large ears, and a prominent forehead. Most post-pubertal males also have macroorchidism. What are other trinucleotide repeat disorders, and why are they associated with permutations? Other disorders attributable to trinucleotide repeat expansion include Huntington disease, which is CAG expansion on chromosome 4, myotonic dystrophy, Friedreich ataxia. Typically, higher numbers of trinucleotide repeats result in more severe and earlier onset of the phenotypic expression of disease. Permutation occurs in patients with an intermediate number of repeats who are clinically normal but whose children are at an increased risk of expressing clinical disease. Anticipation is the worsening of disease through generations because of increasing number of trinucleotide repeats.